லாஸ்ட் டைம் 2023 ஏப்ரலில் நடந்த MRB Pharmacistோட பேட்ச் 2 கொஷின் பேப்பர் தான் பார்க்க போகிறோம். அதாவது 26th ஏப்ரல் ஆஃப்டர்நூன் செஷனில் நடந்த கொஷின் பேப்பர் தான் இப்போ டிஸ்கஸ் பண்ண போகிறோம். ஃபர்ஸ்ட் செஷன் கொஷின் பேப்பர் ஆல்ரெடி அப்லோட் பண்ணியாச்சு, பார்க்காதவங்க போய் பார்த்துருங்க. ஓகே, இது வந்து செகண்ட் பேட்சோட கொஸ்டின்ஸ் பார்க்கலாம். ஃபர்ஸ்ட் கொஸ்டின், how many grams of water are needed to make 150 gram of 4% water solution of potassium acetate? Correct answer is option B, 144. Next question. The recommended container for inhalations and sprays is. Recommended container for inhalation and sprays is options: colorless fluted bottles, amber colored bottles, wide mouthed ribbed bottles, narrow mouthed bottles. Correct answer is option A, colorless fluted bottles. Recommended container for inhalation and sprays is colorless fluted bottles. Okay, next question. Tetany is due to the deficiency of. Tetany is due to the deficiency of options: calcium, magnesium, phosphorus, manganese. Tetany is due to the deficiency of option A, calcium. Next question. Gluconeogenesis predominantly takes place in. Gluconeogenesis predominantly takes place in options: liver, brain, skeletal muscle, adipose tissue. Gluconeogenesis predominantly takes place in option A, liver. Okay, next question. Glycosouria is seen in options: urinary tract infection, hypertension, diabetes, respiratory tract infections. Correct answer is glycosouria is seen in option C, diabetes. Next question. Pyuria is the presence of dash in urine. Pyuria is the presence of dash in urine: increased number of RBC, red blood cells, increased number of pus cells, increased number of epithelial cells, increased number of platelets. Pyuria is the presence of increased number of pus cells in the urine. Option B, increased number of pus cells. Next question. Enzymes are dash in nature. Enzymes are dash in nature: fats, nucleic acids, proteins, carbohydrates. Enzymes are option C, proteins in nature. Enzymes are proteins in nature. Next question. As the concentration of enzyme is increased, the velocity of the reaction proportionately dash. As the concentration of enzyme is increased, velocity of the reaction predominantly increases. Next question. The following drugs are used in the treatment of malaria except. Following drugs are used in the treatment of malaria except chloroquine, primaquine, artesunate, chloramphenicol. Correct answer is option D, chloramphenicol. Next question. Quartan malaria fever is due to. Quartan malaria fever is due to Plasmodium ovale, Plasmodium vivax, Plasmodium malariae, Plasmodium falciparum. Correct answer is quartan malaria fever is due to Plasmodium malariae. Option C is the right answer. Next question. Which of the following is not a source of surface water? Which of the following is not a source of surface water? Rivers, streams, ponds, shallow wells, impounding reservoir. Correct answer is option C, shallow wells. Which of the following is not a source of surface water? Shallow wells. Okay, next question. Which of the following test is used to determine the prevalence of tuberculosis infection? Test to determine tuberculosis infection. Options: sputum acid-fast bacilli examination, cartridge based nucleic acid amplification test, Montague's test, blood test. Correct answer is option C. Montague's test is used to determine the prevalence of tuberculosis infection. Next question. What percentage of total calories should be from fat? What percentage of total calories should be from fat? Options 10 to 30%, 7 to 15%, 65 to 80%, 1 to 7%. Correct answer is 10 to 30% of total calories should be from fat. Next question. Burning feet syndrome is seen in the deficiency of. Burning feet syndrome is seen in the deficiency of riboflavin, pyridoxine, pantothenic acid, vitamin B12. Burning feet syndrome is seen in the deficiency of riboflavin, pyridoxine, pantothenic acid, vitamin B12. Okay, next question. The neurotransmitter released in the neuromuscular junction is. Neurotransmitter released in the neuromuscular junction is dopamine, serotonin, acetylcholine, adrenaline. Correct answer is the neurotransmitter released in the neuromuscular junction is acetylcholine. Option C is the correct answer. Next question. Loss of sense of smell is called as. Loss of sense of smell is called as anosmia, aphasia, ageusia, photophobia. Correct answer is option A. Next question. Beta cells of pancreas secrete insulin, glucagon, somatostatin, pancreatic polypeptide. Beta cells of pancreas secrete option A, insulin. Next question. Lipase helps in the digestion of. Lipase helps in the digestion of options protein, carbohydrate, fats, minerals. Correct answer is lipase helps in the digestion of option C, fats. Okay, next question. Antidiuretic hormone acts on options proximal convoluted tubule, collecting duct, ascending limb of loop of Henle, descending limb of loop of Henle. Correct answer is option B, collecting duct. Next question. Okay. The first heart sound is due to closure of. First heart sound is due to the closure of AV valves, semilunar valves, atrial contraction, ventricular filling. Correct answer is the first heart sound is due to closure of AV valves, atrioventricular valve. Next question. Simple cuboidal epithelium is present in the below mentioned organ. Simple cuboidal epithelium is present in options thyroid follicle, skin, uterus, trachea. Correct answer is option A, thyroid follicles. Simple cuboidal epithelium is present in the below mentioned organ. Correct answer is option A, thyroid follicles. Next question. Lack of intrinsic factor with failure in absorption of vitamin B12 results in hemolytic anemia, pernicious anemia, aplastic anemia, jaundice. Correct answer is lack of intrinsic factor with failure in absorption of vitamin B12 results in option B, pernicious anemia. Next question. As per the Poisonous Act, license is granted by Central Government of India for options import, export, possession, sale. As per the Poison Act, license is granted by Central Government of India for import, possession, sale. Next question. All India Pharmaceutical Congress Association was started in. All India Pharmaceutical Congress Association was started in 1940. All India Pharmaceutical Congress Association was started in 1940. Next question. Central Register for Pharmacists is maintained by. Central Register for Pharmacists is maintained by Central Council. Next question. The punishment for contravention of Drug and Magic Remedies Act on first conviction is. Options: imprisonment up to 1 month or fine or both, imprisonment up to 8 months or fine or both, imprisonment up to 1 year or fine or both, imprisonment up to 6 months or fine or both. Correct answer is the punishment for contravention of Drug and Remedies Act on first conviction is imprisonment up to 6 months or fine or both. Okay, next question. Drugs Technical Advisory Board consists of dash number of ex officio members. Drugs Technical Advisory Board consists of dash number of ex officio members. Correct answer is Drug Technical Advisory Board consists of 8 number of ex officio members. Option C. Next question. Any record, register or other document seized by the drug inspector should be returned to the persons from whom they were seized within a period of. Options: 20 days, 30 days, 45 days, 60 days. Correct answer is option A, 20 days. Next question. Drug store in a rural area can be started with dash financial resources. Drug store in rural area can be started with dash financial resources: limited, unlimited, credit, daily wages. Correct answer is drug store in rural area can be started with limited financial resources. Next question. Partnership is dash if one of the partner dies. Partnership is dissolved if one of the partner dies. Next question. Which of the following is shown on the debit side of trial balance? Commission received account, rent received account, discount allowed account, discount received account. Which of the following is shown on the debit side of trial balance? Correct answer is option C, discount allowed account. Next question. The process of finding the net amount from the total of debit and credit columns in the ledger is known as. Options: casting, posting, journalism, balancing. Correct answer is option C, journalism. Process of finding the net amount from the total of debit and credit columns in a ledger is known as journalism. Okay, next question. Commercial banks generally provide loans for long period, short period, medium term, installment. Commercial banks generally provide loans for long period, short period and medium term. Next question. In a drugstore, the expiry dated drug formulations are called. In a drugstore, the expiry dated drug formulations are called dormant material, surplus items, scrap items, obsolete items. Correct answer is in a drugstore, the expiry dated drug formulations are called dormant materials, scrap items, obsolete items. Okay, next question. Bedding capacity of large hospitals: 1000 and above, 200 above, 500 above, between 800 to 1000. Correct answer is option A, 1000 and above. Next question. Hadi Committed has recommended that IV fluids manufacturing in hospitals should be done under the supervision of person with dash qualification: M Pharm, B Pharm, Pharm D, D Pharm. Correct answer is Hadi Committed has recommended that IV fluids manufacturing in hospital should be under the supervision of person with M Pharm qualification. Next question. Following are the objectives of the procurement of medicines except. Following are the objectives of procurement of medicines except select reliable suppliers, ensure timely delivery, achieve the lowest possible total cost, maximum stock level. Correct answer is option D, maximum stock level. Next question. Charge and non-charge patient medications come under dash system. Charge and non-charge patient medication comes under dash system. Options: individual prescription order system for inpatient, individual prescription order system for outpatient, complete floor stock system for inpatient, complete floor stock system for outpatient. Charge and non-charge patient medication comes under option C, the complete floor stock system for inpatient system. Okay, next question. Hepatitis B is also called. Hepatitis B is also called infectious hepatitis, delta hepatitis, serum hepatitis, infectious and delta hepatitis. Hepatitis B is also called option C, serum hepatitis. Serum hepatitis. Next question. Polyuria, polyphagia, polydipsia are the symptoms of. Polyuria, polyphagia, polydipsia are the symptoms of. Options: tuberculosis, arthritis, diabetes, ulcer. Polyuria, polyphagia, polydipsia are the symptoms of option C, diabetes. Okay, next question. Which antihypertensive drug can be taken during pregnancy? Which antihypertensive drug can be taken during pregnancy? Options: nifedipine, propranolol, thiazides, ACE inhibitors. Correct answer is option A, nifedipine. Which antihypertensive drug can be taken during pregnancy? Option A, nifedipine. Next question. Any noxious change which is suspected due to any noxious change which is suspected to be due to drug occurs at doses normally used in man is called as adverse drug reaction, drug interactions, medication error, life-threatening reaction. Correct answer is option A, adverse drug reaction. Noxious change due to drug occurs normally used in man is called adverse drug reaction. Next question. Theophylline is methylxanthine derivative, beta-2 agonist, sympatholytic agent, parasympatholytic agent. Theophylline is a methylxanthine derivative. Next question. Latanoprost is the prostaglandin analog, alpha-adrenergic agonist, carbonic anhydrase inhibitor, beta blocker. Correct answer is option A, prostaglandin analog. Which of the following is a prodrug? Captopril, enalapril, hydralazine, clonidine. Correct answer is option B, enalapril. Which of the following is a prodrug? Enalapril. Next question. Pharmacodynamics relates to drug elimination, drug excretion, drug absorption, mechanism of action. Pharmacodynamics related to option D, mechanism of action. Pharmacodynamics, drug does to the body. Okay, next question. High efficacious and most commonly used LDL cholesterol lowering HMG-CoA reductase inhibitor. High efficacious and most commonly used LDL cholesterol lowering HMG-CoA reductase inhibitor. Lovastatin, simvastatin, atorvastatin, parastatin. Correct answer is option C, atorvastatin. Next question. Prolonged use of hydralazine therapy is likely to develop thrombocytopenia, hemolytic anemia, gynecomastia, lupus erythematosus. Prolonged use of hydralazine therapy is likely to develop hemolytic anemia and lupus erythematosus. Okay. Prolonged use of hydrolyzing therapy is likely to develop hemolytic anemia, lupus erythematosus. Next question. Which of the following drug may cause reversible gynecomastia? Options: omeprazole, pyrinazepine, cimetidine, surfactant. Okay, correct answer is option C, cimetidine. Which of the following drug may cause reversible gynecomastia? Cimetidine. Next question. Which of the following glucocorticoids is a long-acting drug? Which of the following glucocorticoids is a long-acting drug? Prednisolone, dexamethasone, triamcinolone, aldosterone. Correct answer is option B, dexamethasone. Okay. Next question. Macrolide antibiotic. Macrolide antibiotic. Erythromycin, pilocarpine, physostigmine, hycosine. Okay. Correct answer is macrolide antibiotic. Option A, erythromycin. Macrolide antibiotic, erythromycin. Next question. Influenza antiviral drug is. Influenza antiviral drug is amlodipine, nifedipine, amantadine, felodipine. Influenza antiviral drug is amantadine. Option C is the right answer. Okay, next question. The following are the botanical source of cinchona except. Following are the botanical source of cinchona except Cinchona indica. Next question. Keller-Kilani test is used to detect. Keller-Kilani test is used to detect digitox. Next question. D-linalool is the main constituent of. D-linalool is the main constituent of. Option A, coriander. D-linalool is the main constituent of coriander. Aldobionic acid is the main constituent of. Aldobionic acid is the main constituent of isabgula. Next question. A fruit which is used as a diuretic. A fruit which is used as a diuretic. Options: fennel, amla, gokro, ajuvan. Correct answer is option C, gokro. Fruit which is used as a diuretic. Okay. Indole group of alkaloids present in. Indole group of alkaloids present in cinchona and nux vomica, nux vomica and ravolfia, cinnamon and cinchona, vasica and ipecac. Correct answer is option B, nux vomica and ravolfia. Okay. Next question. Which one of the following drug belongs to Rubiaceae family? Which of the following drug belongs to Rubiaceae family? Options: cinchona, ergot, nux vomica, ephedra. Correct answer is option A, cinchona. Next question. Chrysanthemum cineifolium is a botanical source of pyrethrum. Next question. Chrysanthemum cineifolium is the botanical source of option Shank fusfi, Shatavari, pyrethrum, tobacco. Correct answer is option C, pyrethrum. Next question. The chemical constituent of ipecac include the following except. Chemical constituents of ipecac include the following except linalool. Next question. In fennel, lignified reticulate parenchyma is present in the dash region of fruit. In fennel, lignified reticulate parenchyma present in the epicarp, mesocarp, endocarp, endosperm region of fruit. Next question. Sodium bicarbonate on heating gives sodium carbonate plus carbon dioxide, sodium chloride plus carbon dioxide, sodium hydroxide plus carbon dioxide, sodium sulfate plus carbon dioxide. Sodium bicarbonate on heating gives sodium carbonate plus carbon dioxide. Next question. Aluminum hydroxide gel IP contains aluminum hydroxide gel IP contains aluminum oxide, hydrated aluminum oxide with varying quantities of basic aluminum carbonate and bicarbonate, aluminum hydroxide. Correct answer is aluminum hydroxide gel IP contains hydrated aluminum oxide with varying quantities of basic aluminum carbonate and bicarbonate. Option C is the correct answer. Next question. A drug commonly used in shampoo for treating dandruff. Drug commonly used in shampoo for treating dandruff. Selenium sulfate, sulfur, yellow mercuric oxide, hydrogen sulfate. Correct answer is option A, selenium sulfate. Next question. Which is used to prepare styptic pencil? Zinc oxide, sodium sulfate, potassium permanganate, alum. Correct answer is option D, alum. Next question. Molecular weight of potassium acetate. Molecular weight of potassium acetate 98.15 gram per mole. Molecular weight of potassium acetate 98.15. Next question. Synonym of ferrous sulfate is. Synonym of ferrous sulfate is white vitriol, yellow vitriol, orange vitriol, green vitriol. Correct answer is option D, green. Synonym of ferrous sulfate is green vitriol. Tartar emetic is potassium tartrate, sodium potassium tartrate, antimony potassium tartrate. Correct answer is tartar emetic is antimony potassium tartrate. Okay, next question. Iodinated albumin injection is used for. Iodinated albumin injection is used for determination of blood volume and investigation of CVS function, investigation of liver function, renal function investigation, investigation of lung function. Correct answer is iodinated albumin injection is used for determination of blood volume and investigation of CVS function. Okay, next question. Vacuum salt made by purification of rock salt contains more than 99.9% of. Vacuum salt made by purification of rock salt contains 99.9% of sodium chloride. Okay, next question. If a drug melts sharply at the stated melting point, it means that drug is a options pure drug, impure drug, adulterated drug, deteriorated drug. Correct answer is if a drug melts sharply at the stated melting point, it means the drug is option A, pure drug. Next question. Rifampicin is stored at a temperature not exceeding dash in an atmosphere of nitrogen in airtight container. Rifampicin is stored at temperature not exceeding 15 degrees Celsius in an atmosphere of nitrogen in an airtight container. Option B, 15 degrees Celsius. Next question. Liquefied phenol contains 80% of water, phenol and water. 80%. Okay, next question. Caffeine contains dash ring system. Caffeine contains dash ring system. Caffeine contains xanthine ring system. Options are phenothiazine, pyrazole, xanthine, piperidine. Caffeine contains xanthine ring system. Okay. Okay, next question. Analeptics is a reference to. Options: anti-epileptics, central nervous system depressants, anesthetic agents, central nervous system stimulants. Correct answer is option D, central nervous system stimulants. Next question. Menadione is used as a coagulant. Quinolone derivative, naphthoquinone derivative, anthraquinone derivative, anthracene derivative. Correct answer is option B, naphthoquinone derivative. Next question. An amide form of local anesthetic drug also used as anti-arrhythmic agent is. A amide form of local anesthetic drug used as anti-arrhythmic agent is procaine, benzocaine, cocaine, procamide. Correct answer is option D, procamide. Next question. Daunorubicin contains pyrimidine nucleus, triazine nucleus, morpholine nucleus, anthracycline nucleus. Correct answer is option D, anthracycline nucleus. Daunorubicin contains anthracycline nucleus. Next question. Isoniazid is always preferred to be used for first 7 months in combination with. Isoniazid is always preferred to be used for first 7 months in combination with dash to avoid the development of resistance against tubercular bacilli. Okay, correct answer is isoniazid is always preferred to be used for first 7 months in combination with rifampicin to avoid development of resistance against tubercular bacilli. Option A, rifampicin. Okay, next question. Phenytoin is a dash derivative. Phenytoin is a dash derivative. Phenytoin is a hydroxide derivative. Option A is the correct answer. Next question. Radio opaque materials have the ability to absorb. Radio opaque materials have the ability to absorb. Option D, X-rays. Next question. The thickening agent used for mixtures containing resinous tinctures. Acacia, starch, trachagan, sodium alginate. The thickening agent used for mixtures containing resinous tinctures. Correct answer is acacia and trachagan. Okay, next question. Calamine lotion BP, British Pharmacopoeia, is a suspension containing indiffusible solids, suspension containing precipitate forming liquid, suspension containing diffusible solids, suspension produced by chemical reaction. Calamine lotion BP is a suspension containing indiffusible solids. Option A is the correct answer. Next question. White petrolatum is also known as white wax, yellow wax, petrolatum, white petroleum jelly. Correct answer is option D, white petroleum jelly. White petrolatum is also known as white petroleum jelly. Which method is used for preparation of ointment containing a solid medicament? Which method is used for preparation of ointment containing a solid medicament? Options: fusion, titration, chemical reaction, emulsification. Correct answer is fusion and titration. Method used for preparation of ointment containing solid medicament. Okay, next question. Okay, during the preparation of parenteral products, all the containers and closures are thoroughly cleaned with alcohol, detergents, acetone, ether. During the preparation of parenteral products, all the containers and closures are thoroughly cleaned with detergents. Next question. Dash are used for pyrogen testing. Dash are used for pyrogen testing. Mice, guinea pig, rabbits, rat. Correct answer is rabbits are used for pyrogen testing. Next question. Geometric dilution is used for. Geometric dilution is used for mixing of potent drug, mixing of dusting powder, mixing of snuffs, mixing of tooth powder. Correct answer is option A, mixing of potent drug. Geometric dilution is used for mixing of potent drug. Okay, next question. Suppositories are most frequently prepared by this method on a small scale and on a industrial scale. Suppositories are most commonly prepared by this method. Compression, molding from melt, hand rolling and shaping, rolling. Correct answer is molding from melt. Next question. Direction to the pharmacist for preparing the prescription is given in. Direction to the pharmacist for preparing the prescription is given in inscription, superscription, subscription, signature. Correct answer is direction to pharmacist for preparing the prescription is given in subscription. Okay, next question. The Latin term pulvis conceptus refers to poultice, powder, ointment, dusting powder. Correct answer is option D, dusting powder. Next question. Dalton's law may be mathematically expressed as. Dalton's law may be mathematically expressed as total pressure is equal to PA by PB. Okay, next question. A liquid is distilled at a temperature lower than its boiling point by the application of vacuum is extractive distillation, distillation under reduced pressure, molecular distillation, steam distillation. Correct answer is option B, distillation under reduced pressure. A liquid is distilled at temperature lower than its boiling point by the application of vacuum is distillation under reduced pressure. Next question. Thin coating applied to small particles of solids, droplets or liquids or dispersion is known as film coating, micro encapsulation, polishing, entry coating. Correct answer is option B, micro encapsulation. Next question. Most commonly used base for chewable tablet is. Most commonly used base for chewable tablets is glucose, mannitol, lactose, sucrose. Correct answer is option B, mannitol. Most commonly used base for chewable tablet is mannitol. Okay, next question. Continuous hot extraction should be avoided when the constituents of the drug is. Continuous hot extraction should be avoided when the constituents of a drug is porous, fragile, thermoliable, heat resistant. Correct answer is option D, thermoliable. Next question. Film evaporated will yield only. Film evaporator will yield only solid particles, dry products, gritty products, liquid products. Film evaporator will yield only liquid products. Next question. Okay. Talc, sugar and Fuller's earth are filtrates, diluents, glidants, lubricants. Filtrates. Next question. Contamination of a milled parts is very low or negligible in ball mill, hammer mill, fluid energy mill, disintegrated. Contamination of a milled parts is very low or negligible in fluid energy mill.